Welcome to our channel. In this video we will discuss about congestive heart failure. Congestive heart failure is defined as a complex clinical syndrome that results from structural or functional impairment of ventricular filling or ejection of blood, which in turn leads to the cardinal clinical symptoms of dyspnea and fatigue and signs of heart failure, namely edema and rales. Make note that earlier heart failure was categorized into systolic and diastolic dysfunction, but now heart failure is broadly categorized into heart failure with reduced ejection fraction and heart failure with preserved ejection fraction respectively. Any condition that leads to an alteration in left ventricular structure or function can predispose a patient to developing HF. For example, reduced ejection fraction heart failure or systolic dysfunction can be caused by several diseases such as coronary artery disease, hypertension, congenital heart diseases that cause left-to-right shunts, also by chronic lung diseases such as cor pulmonale. And for example, preserved ejection fraction heart failure can be caused by hypertrophic cardiomyopathies, aging, restrictive cardiomyopathy. The conditions that were listed can cause alteration to the left ventricular structure and function. Filling pressures or diastolic dysfunction, including dyspnea, peripheral edema, and ascites. Heart failure is a chronic and progressive disease that can be assessed by following the patient's exercise tolerance, such as the New York Heart Association, NYHA, functional classification. This functional classification carries prognostic significance. Individuals in Class 3 who have low oxygen consumption during exercise have an annual mortality rate of 20%, in Class 4, the rate is 60% annually. Patients with a low ventricular ejection fraction, with less than 20%, also have very high mortality risks. Death associated with CHF may occur from the underlying disease process, cardiogenic shock, or sudden death as a result of ventricular arrhythmias. Make sure to leave a comment below, like and to follow our Instagram page. Thank you for watching.